I'll bring in my colleagues, the host of Power and Politics, Vashi Kapellas, and the CBC's Catherine Cullen. We are expecting, I would think, for the Prime Minister to get a fair number of questions today about some of the things that provinces are increasingly talking about, what we would expect to come up in the Premier's call today that they now have weekly, and this is around testing and also around contact tracing, because we've seen some pretty stark numbers in terms of testing in Ontario over the past number of days, nowhere near hitting what their target was in any way, Vashi.
Yeah, I think this is the province to start that discussion for sure, and it certainly is a point of tension to a degree between provinces and the federal government. You'll know for sure that last week in that call, the federal government essentially said, we're here to give you money for that, to increase testing, not only capacity, but the actual number of tests you're doing, as well as contact tracing. It does depend where you live. This is being done very well in certain provinces like Alberta and BC, for example, less so in Ontario, and I'd point to the last 4 days as evidence of that. The goal where capacity is concerned, as the Premier has set out, is 20,000 tests a day. For the last 4 days, they have come nowhere near that. I think in the last 24 hours, they're just about 50% of that. They were at something like 7,000 tests the day before, about approximately that. So while they occasionally come close to that goal, they are not doing it with any consistency. And that is a central question as we start to see economies reopen across the country, including here in Ontario, which the process, kicked off just a few days ago. Are we doing enough to actually feel safe in that process? Should businesses have faith that they can reopen right now, that it is safe to do so? How can we be sure of that? I spoke to a doctor last night who works in the ICU at Michael Garron Hospital in Toronto, and he pointed out for contact tracing, for example, he doesn't wait until 2 days till he gets the test back. He knows the symptoms now. He starts treating it as COVID. But he has to wait to notify public health at least 2 or 3 days until that official test result comes back, and then they start the contact tracing, finding out who this person has been in contact with. He says, why can't I just let public health know at that moment, and they can start that process right away? There's a lag, and a big lag, and he said that it could, eventually cost lives, or it could be right now costing lives. So I think there are some very specific questions for provincial governments, surely, but also for the federal government, insofar as the Prime Minister has laid out that he wants to increase capacity. He wants to give provinces money for that on both contact tracing and testing, but there's something that isn't happening. So do provinces need to be more explicit with the federal government about what the needs are? Do they need to have a better plan laid out? I know that the Premier of Ontario yesterday expressed frustration and said the numbers will go up, but I'm not hearing any specifics about how exactly they plan to meet the goals that they have set out. And at the end of the day, this isn't just a numbers game, right? This is about you and I feeling safe, and all of the people watching right now when they go into a store, when they leave their home. And I think that is something that a lot of people are thinking about as we do see economies reopen.
Yeah, the agreement is that I think across the country that if we want to reopen, there are a few things that have to be in place. It's more testing, it's more contact tracing, and it's the ability for people to go into isolation for 14 days if they do test positive. And you see places like, as you say, a different picture really across the country. You see places like Saskatchewan, and I'll bring you in, Catherine, too, where today they started allowing people who are working outside the home to go and get tested, because that seems, as of Monday, because that seems to be important. If there's someone going out every day to do their job, they will start to get a sense now, well, am I carrying it or not? Because we know that you can be asymptomatic. And Quebec, too, is not meeting its targets, and yet it also is moving ahead with reopening. So there seems to be, as Vashi points out, some sort of disconnect here.
Yeah, and I mean, there really are, I think, a lot of pieces to this puzzle, and our conversation touches on that. I think the point you raised about Saskatchewan is important. The Prime Minister has said that the federal government is willing to invest in a national framework for testing and contact tracing. He has talked about the need to ramp things up massively. As Vashi has pointed out, Ontario's Premier not satisfied with the testing levels. We know we've heard from the top public health official in Quebec, Dr. Horacio Arruda, that he's not satisfied with how things are going in that province. And obviously in those cases, yes, they're populous provinces, but they're provinces that have been particularly hard hit. And we really don't want to minimize Quebec in particular. The situation on the island of Montreal, around the island of Montreal, really one of the worst in the world right now. So the concern about the levels of testing, very significant. There do seem to be two parts here. Some of it has to do with the physical supplies. We've heard talk about the importance of making sure that can the federal government, for instance, play a role in supplying the appropriate number of swabs, the reagents that are needed to complete these tests. But it's also a question of who you test. Dr. Theresa Tam has talked about this. She says, we have have entered a different phase of things now, and where before we would not have tested people who were just mildly symptomatic, this is something we need to think about now. We need to think about where people are, where they are particularly at risk, be it in long-term care centers, be it homeless shelters, correctional institutions. She talked about Indigenous Canadians, people who might be particularly at risk of catching COVID-19, how the criteria needs to be expanded. So presumably that is going to be part of this conversation, but we will all be watching to see what happens when the Prime Minister, behind closed doors, has his virtual conversation with the premiers tonight. There's broad agreement, but how do you get those numbers up? Canada right now averaging about 28,000 tests a day. Theresa Tam said yesterday the capacity in the public health labs is 60,000. So certainly there is room to grow, but who gets tested?
Yeah. Okay, I'm going to leave it there with both of you just for a moment, if you don't mind, to talk to someone who's trying to work towards some of this contact tracing. Thank you very much. We'll be back to you. The Quebec Premier François Legault says that his province is considering partnering up with a Canadian company called Mila. It's an artificial intelligence institute based in Montreal, and it has been working on an app designed to help with contact tracing. The company's CEO, Valérie Pisano, joins me now from Montreal. Nice to see you.
Thank you.
So as we, as Canadians start to better understand, how we are going to live with this for an extended period of time and understand that it will involve contact tracing and in some places apps. We know that Alberta already has one working. Tell us a little bit about what your app is meant to do and what you would hope it would help with.
Yeah, so COBI is a bit different from the other technologies because it uses AI. So once the app is installed on your device, what it's trying to do is to compute what we call a personal risk factor. Essentially, the app is trying to figure out what are the odds that today you're infected with the virus, even though you feel perfectly fine. And of course, we know that this virus spreads a lot in that period where people are not symptomatic yet. So to do this, what the AI tool does is it factors in personal information about our age, our gender, our health condition, but it also considers what's going on around us, right? Essentially, COBI is keeping track in a completely anonymous and protected way of the symptoms and test results of the people that we've been in close contact with. Why? To help us make decisions on a daily basis about things like using public transport, going back to work, going to stores, visiting with relatives. It really is meant as a personal dashboard to help us make these decisions as we go about our daily lives.
Okay, so it makes me a little nervous just hearing you describe it. And you said that this keeps all the data anonymous and protected. So give me some sense of how you're doing that, how you're keeping the information, how long you're keeping it for, because that's the part I think that people are wary about when it comes to any sort of app.
Yeah, so it's important to say that privacy was at the very heart of how we thought about COBI from day one. We consulted with the Privacy Commissioner of Canada. And in its simplest form, COBI does not collect any information that allows to directly identify someone. So it never knows your name, your phone number, your IP address, or your home address. All the data is encrypted, it's secured, it's deleted as soon as possible. So specifically on phones, that's every 30 days. And the entire project will be managed by a non-for-profit independent organization whose sole purpose is to help Canadians fight the pandemic.
How much of the onus is on the person with the app? Like, how much do I have to be willing to input about my own health, and how important is that to the accuracy of what the app is telling us?
What scientific research is showing us very clearly is that symptoms are a really important predictor of COVID-19, and every half day that we save here can save lives, right? So on the user side, what we're asking people is to report symptoms when they have it. They don't have to do it every day. It can be, as they show up or every couple of weeks. That's the personal side of it. And then, of course, the contact tracing side of it is done more automatically. So essentially, personal risk factors of different users are being exchanged in a confidential and encrypted way, so that if your risk factor goes up, and you and I had coffee 2 days ago, then my risk factor might go up also, and I know that I need to take some additional precaution to keep the people around me safe.
So is there though some trust that you're placing on the individual to input that information on a regular basis and be truthful about it?
Contact tracing technology in general is going to be incredibly democratic and a personal choice, and it will be about empowering people and giving them the tools to do what's right for themselves and for others. For symptoms, it is self-reported. For positive test results, we're talking with public health authorities to see how that could be done in an automatic and validated way. And so essentially, if you get a positive test result, public health authorities would send like a secret key or a secret signal to the COVID app so that we know that it's a validated, true test result.
So what would I see if I was going to open up, just so I get a sense, if I was going to open up your app and start my day, would it tell me hotspots in the city? Would it tell me places I might want to avoid or people I want to avoid? Or what would it look like in terms of information?
Yeah, so really the nucleus of it is a personal recommendation. So it has a daily message with some personalized information. It has a survey to get a sense of what people think, but really the heart of it is your personal daily recommendation. So it might say things like, this week it would be safer if someone else did the groceries for you. It could say, hey, it's a beautiful sunny day and you're perfectly fine. You should go out and try to, get some fresh air. And one day it could say, I think you should call public health authorities or get tested, right? So that's really the heart of how it's designed. It will never give information about who is at risk, who is contagious. It doesn't capture that information, doesn't share it with users. But for public health authorities, we will do what you suggested, which is we will be able to create what we call heat maps. Essentially, as risk levels go up, days ahead of actual cases, COVID will be able to see where things are heating up, in which neighborhoods or in which cities, to allow public health authorities to make very local and precise interventions before it actually fires up entirely.
So I know the Premier of Quebec has said he's looking at the app. I know you're talking to other provinces. Have you signed a contract with anyone? Has the federal government come knocking? Can you give me any sense of what the uptake is?
There's a lot of interest, and I think we're super lucky here in Canada to have one of the greatest research scientists in the world that is leading this effort in Yoshua Benjo, who was recently invited to be part of the Royal Society of London alongside people like Einstein. So, of course, there's a lot of interest by all levels of government, and these are important discussions that require certain time and a lot of hard work. So that's what we've been doing for the last few weeks and what we'll continue to do going forward.
So we were just talking with my colleagues before you came on about how, testing is not where it needs to be. Certainly contact tracing is not where it needs to be in many provinces. How critical a piece of do you think this is to us being safe and keeping safe in the weeks ahead?
Yeah, there's no doubt that the best combination is one that uses digital contact tracing and additional testing. This being said, it's an important nuance. So the technologies that are developed, for example, by Apple and Google really require a lot of testing, because what it will do is it will alert someone that they now need to get tested or self-isolate. And until I've actually gone through the testing process and received a negative test result, basically I have to stay home. And so sadly, there will be a lot of people who will err on the side of prudence and will send them into quarantine, but it wouldn't be necessary. With AI, it's possible to imagine a scenario where you hit a certain threshold, we're a bit concerned, we recommend that you self-isolate, but a few days later, the information is updated and we can put the risk level back down and say, you know what, it's perfectly fine for you now to re-engage with your family, go back to work. So it's a much more sophisticated tool than what we call the binary or direct approach that basically is like yes or no, isolate or don't.
I noticed you didn't quite answer my question about whether anyone had signed on to the app. Is that just because conversations are ongoing and there are negotiations ongoing, just so people have a sense?
The direct answer is no one has signed, but there's a lot of interest from many governments.
Okay. Good. I appreciate direct answers. Thank you very much. Thank you, Valérie Pisano. It's really interesting to hear the work you're doing, as many of us are going to have to come to terms with some kind of app in the future. Thank you so much for your time today.
You're welcome.
That's Valérie Pisano. She is CEO of MILA in Montreal. It's an institute specializing, as you heard there, in artificial intelligence. As we stand by for the Prime Minister, we have had our 2-minute warning that he will shortly emerge from his front door there to give us the latest on his government's response to the pandemic. As we mentioned off the top, we do expect the primary funding announcement today to be directed to Indigenous people living off reserve or in urban centres, where there had been $15 million previously previously dedicated. There will be more money given this time, given about half of Canada's Indigenous peoples live off reserve or in communities elsewhere. So that will be an important announcement for those groups. I'll bring back my colleagues, Vashi Kapelis and Catherine Cullen. Oh, there's the Prime Minister, so I won't. I always have the worst timing. It's like he does that to me on purpose. All right, here is the Prime Minister of Canada.
Good morning, everyone.
The first thing I want to talk about today is what we're doing to support Indigenous people during the pandemic. Since day one, our government has been engaging with First Nations, Inuit, and Métis Nation leaders in the fight against this virus. We've been listening to people's concerns and working with local leadership to ensure that communities are getting the right support. And so far, we've taken a number of important steps. We're investing in emergency shelters to help Indigenous women and children fleeing violence. We're offering interest-free loans and non-repayable contributions to help Indigenous businesses weather this storm. We're helping First Nations, Inuit, and Métis Nation students and recent grads find a job this summer. And last week, we announced more funding to support the most urgent needs of Indigenous communities dealing with the COVID-19 outbreak. While all communities have had to wrestle with COVID-19 these past few months, the everyday realities of this crisis are different for everyone. To mount an effective response to this crisis, we must adapt our approach and our programs to recognize and meet the particular needs of all Indigenous peoples, including those living in urban areas and off reserve. To this end, we announced $15 million back in March to support Indigenous organizations that deliver services to these populations as part of the Indigenous Community Support Fund we had set up to help prevent and mitigate the impact of this virus. With this money, organizations have been able to give meals, groceries, clothing, and supplies to those in need and offer mental health counseling. They've also provided personal protective equipment and cleaning supplies for supportive housing and computer and laptops so kids can keep up with their schoolwork. This funding is helping vulnerable people like youth, women, and elders. Indigenous community organizations in our cities and off-reserve do crucial work year-round, but these days their services are in high demand because of the pandemic. We need to make sure they have the resources to adapt and grow their services so they can fulfill their important mission. So today, our government is announcing an additional $75 million in new funding for organizations that address the critical needs of the over 1 million Indigenous people living in urban centers and off reserve. This is critical work. If you live off reserve or in a city, we're working to make sure you don't fall through the cracks. You need and deserve services that are culturally appropriate, and that's what we're doing with today's investment.
Today, our government is announcing a new investment of $75 million for organizations that address the most urgent needs of more than 1 million Indigenous people living in urban centers or off reserve. This is money that community organizations will be able to use to combat food insecurity, support vulnerable seniors, help young people at risk, provide mental health services, and prevent family violence. Now, I would like to directly address employers and property owners. We've been talking a lot about reopening the economy these days, and that's good news for everyone. But if you've had to slow down or stop your activity in recent months, reopening will also present certain challenges. So we are putting measures in place to support you. If you need help to rehire your employees, you can use the emergency wage subsidy. We have just extended that program until the end of the summer. If you're experiencing liquidity problems or if you have expenses to take on, you can receive a loan through the emergency business account. If you're not eligible for those two programs, we invite you to address or go directly to your regional development agency. They will be able to help you. We are also working with the provinces, the territories, and property owners and their tenants to try and lower rents for small businesses. Owners can apply starting on Monday on the website of the Canada Mortgage and Housing Agency. We're all anxious to see life return to normal, but in order for that to happen, everyone must do their part. And employers in particular have an important role to play. When people are thinking of a return to normalcy, one of the first things that comes to mind is going back to work. It's about finding a certain amount of financial stability, seeing their colleagues and friends again, and getting back into their routine. Your employees are counting on you, your community as well. So if you need help, but you're not sure where to start, please go to Canada.ca and consult the COVID-19 page. There you will find more information about all the programs available to you and how to go about getting that support. We are preparing to restart our economy, and I know that together we can come back strong once the crisis is over.
As we gradually and carefully restart some activities, it's never been more important to follow public health instructions. COVID-19 remains a very serious health threat. Yesterday, Dr. Tam said that whenever physical distancing is not possible, Canadians should wear a non-medical mask or face covering when they go out. I want to remind everyone that physical distancing means keeping a 2-meter distance with others. As we start to reopen the economy, it might be more difficult to maintain that distance at all times, so please follow Dr. Tam's advice. Keep washing your hands, stay home, and if you need to, wear a mask. This is the best way to protect both yourself and others.
As we start to gradually reopen the economy, it's important to remember that COVID-19 remains a serious threat to health. Yesterday, Dr. Tam said that Canadians should wear a non-medical mask when they cannot keep a distance of 2 meters from others. As we start to reopen the economy, it could become more difficult to follow the rules involving physical distancing. So it's important to continue Dr. Tan's instructions. Wash your hands, stay home, and, if necessary, wear a mask. That is the best way to protect our health and the health of others.
I want to end today with a piece of good news. Today, more than 230 new officers are graduating from the Royal Military College of Canada. They are part of a new generation of exceptional women and men ready to serve our country with distinction. You have chosen to step up and serve your country, and we could not be more proud of you. Thank you for your example. Thank you for your dedication. Thank you for your love of this extraordinary country, and mostly, thank you for everything you will do for us in the coming years. Congratulations to the class of 2020. Merci.
Merci beaucoup, Monsieur le Premier ministre. On va commencer la conférence de presse avec le téléphone aujourd'hui. Opérateur, c'est à vous.
Thank you. Merci. The first question, Janie Kashagamskam, APTN, line open.
Thank you, Mr. Prime Minister. This question, I know I talked about it yesterday, about communities, about Indigenous communities protecting their members, specifically in Manitoba's Kiosk Dam. You have Fox Lake creating another blockade. And I'm wondering, do you think, specifically Fox Lake, do they have the right to protect their community members like this?
I think every community needs to make sure they're taking decisions to protect their members, but I think there are many ways of going about it. We need to make sure that all different orders of government, including Indigenous governments, are working together with the same goal, which we all share, which is keeping Canadians as safe as possible, recognizing that certain communities and certain individuals are more vulnerable. And I certainly know that across the country there have been excellent and constructive conversations conversations between Indigenous and non-Indigenous leadership in areas of overlap so that we can move forward in a way that protects Canadians, but also allows for a progressive return to normality. Je pense que c'est extrêmement important.
I think it's extremely important that in every community the right decisions are made to keep citizens safe. I know that across the country there are Indigenous communities and non-Indigenous communities that are close by or adjacent, and they are talking about the best way to protect their citizens, particularly at a time when there's talk of reopening the economy. But we all share the same desire, which is to mitigate the expansion and the spread of COVID-19 and to keep our citizens, particularly the most vulnerable, safe. And I know that that's what we will continue to do.
Yes, thank you. And again, I know I spoke to you about this yesterday, but my next question is again concerning early releases of prisoners. And more specifically, we at APTN, we've been asking Bill Blair for about a month now for the number of released inmates that have been released early from federal prisons. We've been trying quite unsuccessfully, but I'm wondering, can you confirm that inmates are being released early, and do you know when we'll get these numbers?
Corrections Canada has from the very beginning taken extremely seriously the responsibility of keeping both inmates and staff safe in their institutions during this pandemic. They have taken a number of steps in terms of reducing mobility between prisons, increasing the access for protective measures, and in certain cases looking at release conditions. Minister Blair will have more to answer on that.
Thank you. Operator, next question.
Thank you. Merci. Next question, Stuart Thompson, National Post. Line open.
Hi, Prime Minister. Thanks for taking the question. I'm just hoping to get a sense of your government's thinking around a potential second wave of infections in the fall. I know there's some concern in provincial governments that Canadians might not take to a second lockdown or maybe even a third or a fourth if it comes to that. Could be for mental health reasons or economic security reasons or just a kind of exhaustion. So I'm just curious, is this something that you are also worried about?
I think one of the things we know is that in pandemics there are usually second waves. The question that we're very much focused on is, as that second wave begins, or as we start to see resurgences in a reopened economy, how quickly are we able to contain them and control them? And that comes down to the scale of testing, the scale of contact tracing we're able to have right across the country. That's why the federal government has stepped up in its offer to provinces to support them in massively scaling up testing capacity and contact tracing capacity. We know, particularly in those areas that are still working to get the spread of the virus under control, it is going to be important to increase testing now, as we're seeing in those areas, but also make sure that as we move forward through the summer and obviously into the fall, we are ready to act extremely quickly so that the population at large won't be in situations of having to go back into confinement. But that depends on citizens doing their part. It also depends on having that testing capacity, and that's what we're moving forward on.
As a follow-up, Stuart?
Yeah, so there have been some countries that even in the first wave have managed to fend off a large amount of infections without a lockdown. I'm thinking of Hong Kong, where they've had barely any deaths, and it's mainly because of mask wearing and a really robust centralized quarantine. And I'm curious if your government has been exploring these other jurisdictions and maybe some other ideas that would allow you to hold off on a lockdown if infections do raise again?
From the very beginning, we have been looking carefully at what other countries have done and drawing from them on elements that we could put forward in our response that would help here in Canada. Obviously, there are many lessons, most many countries around the world got serious in their situations before we did. So we were able to make some very smart choices early on that has largely kept the pandemic within controllable levels in Canada, although there has still been far too many deaths, and we certainly grieve and mourn all of those. We know that there is more to do, and as we reopen, we know that citizens will continue to be extremely vigilant and careful about how they act, because that is going to be a key part of keeping us safe moving forward. So government will do its part, citizens, employers, employees will be doing their part. We need to continue to do everything we can to prevent the need for any further lockdowns the way we've had up till now.
Right from the outset, we've been looking at what other countries were doing in order to learn from those measures that could help us in Canada. And we did take inspiration from some of those measures while adapting them to our own reality. Now, as we move towards a more and more open and active economy, we will need to continue to remain vigilant as a government and have an increased capacity to test and do contact tracing. But at the same time, we expect Canadian citizens to do their part as well. I know they don't want to end up in isolation once again. And whether people are wearing masks or keeping their distance from others or washing their hands regularly or being careful and employers doing their part, all of those things will be very important in terms of our ability to manage a further wave of infection and without our having to go through what we've been through in the last few months.
Thank you. Merci. Prochaine question. Michel Lamarche, TVA. À vous.
TVA. Good morning. I'd like you to comment on private day camps. We're hearing that 71% of them believe that without financial assistance from the federal government, they will have to shut down. Now, the economy is starting to reopen. Do you have any intention of helping these day camps? Well, I think that day camps and other organizations will have to make their own decisions in order to keep Canadians safe. That's their top priority. But there are many industries and many sectors of the economy that will have trouble this summer because of the lack of tourism, because of the lack of travel, and because of COVID-19. And the federal government and provincial governments will have to reflect on how we can ensure that we don't damage the economy too much, because we need to ensure there can be a strong recovery once this is over. Follow-up? Yes, of course, but at the same time, to what extent do you feel that with the reopening of the economy, those camps are important not only for the children and teenagers that work there, but also for the parents? Now, if the wage subsidy criteria were relaxed, that would help those people to hire more monitors. Are you prepared to take that step? Well, I think there is some regional reflection that has to happen, and at the very beginning, we've seen that COVID-19 spreads more readily in camps or in institutions where people spend the entire day working close by other workers. And of course, I think the owners of these day camps will have to reflect on this and remain very diligent in their thinking. I'm not sure what those decisions will be, but I think that people are under a lot of pressure from parents, of course, who would like to be able to send their children to these camps, but they're also concerned about the safety of their children. And these are all things we're going to have to think about in the coming weeks.
Last question.
Thank you. Merci. Prochaine question, Hélène Buzetti, Le Devoir, à vous.
Good morning, Mr. Trudeau. I'd like to come back to the issue of airline companies. We recently saw that Air Canada had lost $2.6 billion in tickets that were bought that were not refunded. The same with Air Transat. So when will your government provide some conditional support to those airlines as long as they refund travelers? I know that there are many Canadians out there who are concerned about the money they've already spent on airline tickets and that they're not obviously going to be able to use. We also realize that the airline sector is vulnerable and that it's facing major challenges. We also know that Canadians have economic concerns, so we will be working with the sector and airlines and Canadians who are worried to try and find some solutions.
I think we recognize how impacted air travel and airlines are by this COVID-19 pandemic. We also recognize that many Canadians are out of pocket for tickets that they are obviously not going to be using. I think we need to have some very careful discussions with airlines, with the air travel sector, and indeed with Canadians who are concerned to try and figure out a way forward where we can ensure that Canadians are treated fairly and our airline industry remains there for when our economy picks up again.
I understand what you're saying, but could you be a bit more clear about this? You say you're seeking solutions, but among those solutions, could you demand that the airlines refund Canadians? Well, we are looking at what other jurisdictions and other countries are doing. We are currently talking to the airlines as well, and we've heard Canadians' concerns. We know that they want to be refunded their money, but they also want us to have an airline industry in future, so because we'll need it, and so that balance will be very important.
Canadians both want to make sure they're not out of pocket, but they also want to know that we do have a future for our airline industry in Canada. It's an important thing for Canadians to continue to have airlines in this country. We need to make sure we're getting that balance right, and we're making it through this in the right way.
Hi, Prime Minister. Tom Perry, CBC. We've seen some shortfalls in testing in places like Ontario and Quebec. You've just said that the federal government offering to invest in a national framework to lead the way on testing and contact tracing. You've got a call with the premiers today. Presuming if they do take you up on your offer, how fast could you roll this out? What's standing in your way? And given the shortfalls we're seeing in places like Ontario and Quebec, should they feel safe as these economies reopen?
We have already seen significant ramp-ups of testing in places like Ontario and Quebec, where there is a need for even greater testing. Last week with the premiers, I laid out that offer that the federal government could take it on, and we got positive responses from right across the country. We're going to continue discussing that tonight and talk precisely about how we can scale up testing immediately in places where it's necessary, like in Ontario and Quebec, and be ready to scale up almost instantly in places where right now the virus is pretty well under control, but any flare-ups need to be responded to extremely quickly. That is the frame that we're laying out. We don't want logistical or financial limitations to keep anywhere in this country held back from doing all the testing that is necessary. That's what the federal government will be there for. Nous savons qu'on a besoin de faire plus de dépistage, plus de vérification de contact,
and more contact tracing,
particulièrement au Québec,
particularly in Ontario and Quebec. But I just want to say that there has been a large increase in the testing that has been conducted recently, and we will continue to do that. We know it's important to ramp up the amount of testing that's being done, and the federal government will be there with resources and equipment for that to happen, just as we've been doing now for several weeks. But there are also different situations. Now, right now in Quebec and Ontario in particular, they need to ramp up their testing immediately. But there are other places in Canada where the need is not there now for more testing because the situation is pretty much under control. But they have to be ready to immediately do a lot more testing if there's a resurgence of the infection in one location or another of COVID-19. And the federal government will be there to support the provinces to get that done.
BC's Premier says that he wants a national policy on paid sick leave. Says it's a crucial part of preventing that second wave of COVID-19. You've got economies opening up. You've got a lot of low-wage workers finding it hard to take sick leave. So would you be willing to look at a national policy on that?
We have already had good conversations on a range of proposals by the provinces. I've heard John Horgan, Premier of BC, directly on this proposal, and look forward to continuing conversations with the provinces on how we can best support people. There's the issue of sick leave. There's the issue of increased childcare spaces. There's the issue of making sure our long-term care facilities are better supported and more protected. There are a number of things that we need to talk about as governments to ensure that we're moving forward in the right way.
Prime Minister Janet Silver, Global News. Canada's spy agency CSIS is warning of a national risk posed by foreign investments. Plus, there are threats from foreign actors to manipulate the Canadian public and interfere with our democracy. I'm wondering, how concerned are you about these reports, and what actions are your government taking to mitigate these concerns?
Our national security agencies do an exceptional job in flagging risks to Canadians and taking action to mitigate those risks. We will always support them and take on their recommendations and make sure that we are doing everything we can to protect Canadians from malicious actors, whether they be foreign or domestic. Okay.
Our security agencies play a critical role in making us aware of threats to Canada and Canadians, and the federal government always follows their recommendations and works with them to ensure the safety and integrity of our systems in Canada.
Last weekend on the West Block, we spoke to China's ambassador to Canada, and when we asked him about the detainment of the two Michaels detained in China, Michael Spavor and Michael Korvic, he said that they were being treated very well. And then he went on to say, and I quote, that actually the biggest issue in our bilateral relationship is still Meng Wanzhou case. So that's why we have made it our position very clear, to make sure that she's back in China smoothly and safely. So the ambassador has linked her case to the two Michaels. I'd like to get your thoughts on that.
We have seen Chinese officials linking those two cases from the very beginning. Canada has an independent judicial system that functions without interference or override by politicians. It is one of the things that is deeply dear to Canadians in our system to keep it strong and assure the division of powers within our democracy. China doesn't work quite the same way and don't seem to understand that we do have an independent judiciary from political intervention. We will continue to follow and uphold the independence of our judicial system while we advocate for the release of the two Michaels who have been arbitrarily detained by China in retaliation for a judicial system that is independent in the way it functions.
Canada has a fully independent judiciary, and that is not exactly the same case in China, and they do not understand that we have no intention of interfering in our judicial system, which is an independent one. It's very important that we defend our values and democratic principles, and we will always do that. So the fact that China is still refusing an independent judicial process and tying that to the arbitrary detention of the two Michaels. Unfortunately, that is a challenge that we are working on and have been for a number of months now. Louis Bouin, Radio-Canada. There are tens of cases of fraud where people are using personal information to open a bank account, and then they request the emergency benefit in the name of that person. What about the extent of that fraud problem, and what can you do in concrete terms right now to stem that kind of fraud? Well, in this situation, we quickly understood that we had to take quick action to help the millions of Canadians who have lost their job because of COVID-19, that would not have any money to pay for their groceries or to pay their rent. It was an emergency. So we introduced measures where we could quickly provide money to millions of Canadians, and more than 8 million Canadians have received the Canada Emergency Response Benefit. Now, we knew right away that there was a possibility that some individuals would try to defraud the government, and we put in place measures not in order to filter applications right away, because that would have slowed down the delivery of that money for months and months, but we introduced measures to detect and recover that money as the pandemic continues, and I can assure you that the Canada Revenue Agency and the public service are working hard to ensure that there are consequences and that we can recover the money from people who defrauded the system. Fraud is unacceptable, and there will be consequences. There are members of the Mohawk community that are blocking the Oka National Park. I'd like to hear your reaction to that. Is it up to members of that community to take that kind of action, and are you afraid that things might go off the rails? Well, I think first of all it's important to understand that we're all seeking the same thing. We want to protect our citizens from COVID-19 and ensure the safety and security of everyone, including and especially vulnerable populations. The government and Indigenous governments have to work together to ensure that we're making the appropriate decisions to protect citizens, even as we try to return to normality with a more open economy. And I think that leadership in these various communities should get together and agree on the best way to do that.
I think it's extremely important that, first of all, we understand we all want the same thing. Every different order of government wants to ensure that citizens, particularly our vulnerable elders and vulnerable citizens, are protected. That's why different orders of government, including Indigenous governments, need to work with nearby communities and ensure that we're finding a balance that protects the citizens first and foremost, but allows for the careful reopening as appropriate of our economies and our communities.
Glenn McGregor, CTV News. Prime Minister, I want to ask you about the airline tickets again, because your two previous responses were not clear. The federal government is the regulator of Canada's airlines. Will you use that power and authority over them to insist the people who paid for tickets and were not given refunds get those refunds?
This is an important issue to Canadians that we are working with the airlines and with Canadians concerned on. We're looking at what other countries have done in these measures, and we're looking to make sure that Canadians are supported financially through this time, but that also we're going to come back with airlines that function here in Canada for the long term. Getting that balance right will be delicate, but it is something that we're working on.
But, Prime Minister, don't you see this as fundamentally unfair that people bought tickets, may never be able to use them, and are now given vouchers instead that they can't use? Don't you just think it's a matter of fairness and it's the right thing to do, whatever the issues the airline industry is facing right now?
This is why we are working with all concerned parties to try and find a solution. Merci tout le monde.
Merci.
That is the Prime Minister of Canada on this Thursday with his government's latest response to the pandemic. The announcement today, $75 million in new funding for the half of the Indigenous people in this country who live in urban centres or off reserve to make sure that they don't, as the Prime Minister said, fall through the cracks. It follows other announcements for First Nations, Métis communities and the Inuit of more than $300 million that had been made previously. Before I talk, though, to my colleagues about what a lot of the questions were around, not only airline travel and whether you should get your money back if you lost a ticket, but contact tracing and testing, I want to turn our attention to the story that we've been talking about throughout this as we concentrate on what has become, as you well know, the epicenter of this virus, and that is in long-term care centres. And because that happened primarily in Ontario and Quebec, which were hardest hit, hundreds of soldiers and military medical personnel were deployed to play a critical role both here in Ontario in those long-term care homes and in Quebec. Lieutenant Colonel James Stalker is the commanding officer of the Territorial Battle Group 1, and his soldiers are helping do some of that care in facilities across the Greater Toronto area. Lieutenant Colonel Stalker joins us now. Good to see you.
Good morning, Ms. Barton. How are you?
I'm good. Please call me Rosemary. I know that's how the military is trained, but please feel free to call me Rosemary. So thank you for making the time, because we did want to highlight some of the work that many soldiers have been doing. Can you give us just a sense of what kind of things people are doing inside the long-term care centers?
Yeah, certainly. I want to start by thanking you very much indeed for your interest in our work there. So the work the soldiers are doing in the long-term care facilities, and it's soldiers, sailors, and aviators as well, is really tremendous work. It's the shift breakdown in the homes is a mix of medical personnel, and those medical personnel are led by a nurse and a team composed primarily of medical technicians. And they're augmented by some what we call general duties personnel. So the medical teams will do what you'd expect medical teams to do, primarily clinical work and direct patient care for the residents in those facilities. Our general duties personnel augment by doing tasks like disinfecting, like cleaning, like laundry, like food portering, and even some light organizational work for the homes. It's an integrated team, and the team itself is integrated into the larger staff metric within the home. So they integrate within the larger staff of the facility itself.
So they're sort of doing anything they can to help, whether they have medical training or not. Is that fair to say?
That's correct. We're there as a supporting agency. We're there in support of the civil authorities, and we're there to support those homes in any way we can.
So you yourself have been deployed to Kandahar. You've led other big organizational logistical missions with the G8, G20 summits, and I'm sure many of your colleagues, other soldiers, have done all sorts of different kinds of missions. How was this one different, given the nature of the work? How did you prepare for it?
It's a great question. I think that every mission is singular. Every mission has its own unique challenges, but this is perhaps more unique than most. I don't think any soldier or sailor or aviator envisioned working in a long-term care facility, but this was the need of Canada and Canadians, and it's a way for us really to serve. And I think that military personnel are driven first and foremost by a desire to serve, and this is how we can serve Canada and Canadians in their hour of greatest need. So if I was going to offer sort of one word to describe the mood or the tenor here, it would be motivated, and motivated to help, and motivated to help as part of a broader pan-governmental response to this crisis.
What kind of training did the non-medical soldiers get? I understand that there was sort of a 30-minute video on some do's and don'ts around COVID-19, and I wondered, was that enough preparation for, as you say, a mission that is so unusual, that is really unprecedented?
What I would offer is that the soldiers of TBG-1 have actually been preparing for this for a little bit longer than that. So TBG-1 was formed as a rapid response unit in response to both the COVID crisis, but also the potential of floods and forest fires, other domestic emergencies. And we actually deployed to board and back in early April. And from the beginning of that deployment, we've been following pretty strict social distancing and forced health protection measures, frequent hand washing, training in personal protective equipment, distancing, et cetera. And then there was additional specific training for this mission in terms of care for elderly residents and advanced training in the donning and doffing of personal protective equipment. So I think the TBG itself was actually quite well prepared for the task.
Okay, that's good to know. You talked about PPE. Obviously, that's critical for all of you, keeping one another safe as well. Are soldiers, are they wearing N95 masks as a rule of thumb, or how do you make a decision about who wears them and who doesn't?
It's another great question. So the decision on which PPE to wear in what situation is driven by medical guidelines, by the provision of advice of medical authorities, be it the Public Health Agency of Canada, be it our own CAF health network. And so they have pretty stark guidelines on what PPE to wear in what situation, depending on the level of risk, depending on the level of potential infection, and we really conduct ourselves accordingly. So whether it's a breakdown by sort of by zone, whatever the case may be, we follow the relevant what we call IPAC, infection prevention and control guidelines for each facility and for each zone.
So you're not systematically wearing an N95 mask. Would that be fair to say that sometimes you might be wearing a regular surgical mask?
All I can offer on this is that we follow the guidelines of medical advisors. So they offer a range of guidelines depending on the situation, and we simply conduct ourselves accordingly. And we found that really to be the best practice for our people.
I know last week we had confirmation that there was one soldier who had contracted COVID-19 in Ontario, and then more in Quebec. Can you give us any sense of whether that number has increased, and how you are then protecting one another, given that happened and everyone was aware that was part of the risk, I guess?
Yeah, definitely every deployment has risks, and this is one of the risks on this deployment. I'll actually answer the second part of your question first, which is we have quite robust isolation and treatment protocols. I can't really get into specifics because there's matters of medical privacy, et cetera, involved there, but we have quite a robust procedure in the event that someone is symptomatic or positive, and that is all subject to the best advice, again, of the medical professionals who are part of this comprehensive team to assist these homes. In terms of the numbers themselves, unfortunately, I'm not the release authority for that. Any numbers I could provide to you would be preliminary. So the next government update is scheduled to be released on the 29th, and that will provide you the most consolidated and accurate figure.
That's great. Let me ask you this too, Lieutenant Colonel. It would seem to me that this could potentially be very emotionally draining. The Prime Minister talked at one point about how soldiers shouldn't be looking after seniors, and I think everyone agrees that this is something that we're going to need to correct moving forward. I only have about a minute left, but how are you dealing with that, the deep sadness of this as well, the emotional toll it's taking?
There's certainly a very serious sort of human aspect to this, and how my soldiers are dealing with it, soldiers, sailors, and aviators, is really in terms of giving back. So one salient anecdote that I might leave you with is our soldiers and sailors and aviators in their few off minutes in the homes have been going above and beyond to help out the residents. So I do have one report of one soldier who's quite a gifted piano player, as it turns out, and in his spare time, such as it is, he plays piano in one of the homes, and it immediately sort of lifts the atmosphere a little bit. And it's one of those human touches that we can add.
Lieutenant Colonel Stalker, thank you so much for making the time, and thanks to you and all your colleagues for the hard work you're doing. We do appreciate it, sir.
Thank you very much indeed.
We're going to take a short break here on CBC News Network. More on the battle against COVID-19 after this short break. You're watching CBC News Network. Hello again, I'm Rosemary Barton here in Ottawa. Welcome to our special COVID-19 coverage on CBC News Network, streaming on our app and our website around the world. Ottawa has just pledged more support for Indigenous people during the pandemic. The Prime Minister announced $75 million in new funding for groups that help Indigenous people living off-reserve and in urban centres. Also ahead, hard-hit Ontario and Quebec are struggling to reach testing targets, so we will look at how the provinces are dealing with that during this crucial reopening phase. This is happening as some provinces consider using some contact tracing apps. As we know, some people further along on all of this than others. I'll bring in my colleagues, the host of Power and Politics, Vashi Kapelis, and the CBC's Catherine Cullen, as we wait for our noon briefing to begin. I didn't speak to you after the Prime Minister because I wanted to get our Lieutenant Colonel in to talk about that. But there were a lot of questions, not surprisingly, about testing and about contact tracing in light of the fact that there will be a call with First Ministers, with Premiers tonight, Vashi.
Yeah, and we know that this will be the subject of that call, or at least one of the subjects of that call, as it was exactly a week ago with the Premiers when the Prime Minister conducted the now weekly conference call with them. I think that there are a couple of questions that remain for the federal government and for provincial governments. We heard from the Prime Minister that there is the desire on the part of the federal government to see capacity ramp up. There is obviously the caveat that depends on where you live. There simply isn't the demand for testing, for example, in, let's say, British Columbia right now, as there is in Ontario, because of the sort of place that we are on the curve, on the curve where the virus is concerned. But there aren't a lot of specifics being offered by the federal government other than the testing capacity right now across the country is 60,000. It should be higher. How much higher? What exactly do you want to see when it comes to contact tracing? What I'm sort of not clear on at this point, I guess, is like if there is a strategy that's going to be put in place, clearly the provincial government needs to say this is what we need, depending on whatever province you're in. But besides money, is the federal government going to play more of a role, I guess? And I know there are sort of points of conflict there. I don't think that the federal government, from my conversations, is happy with necessarily all the plans that have been presented so far, or the degree to which they're being presented, so they're not complete at this point. So I wonder where that conversation is going, and I do think it is somewhere to watch. Dr. Theresa Tam, who we're waiting for right now, I think will be asked more about this, and yesterday had some very interesting comments that I was interested in, just because she talked about sort of the reasons why we weren't at that capacity. We're only at half the capacity right now, and a lot of it has to do with criteria, which Catherine and you both flagged earlier. So where can you get, like, with symptoms, without symptoms, how many tests, what do you have to be presenting in order to get the test? And that wildly varies depending where you are in this country. And so you wonder if there needs to be a more consistent approach with that, or I think there are a lot of factors that go into it, but the bottom line is if we're reopening our economies, you need to be testing a lot more, and you need to be more aggressively contact tracing, and I don't know who's leading the charge there.
Yeah, I mean, I think that the conversation last week, from what I understand, people were receptive to the notion that the federal government, as we were talking about, is willing to put up money, people, equipment, whatever they need for provinces to move forward with this. I guess the question is, where is the ask from the province? What specifically are they asking for? What is the federal government willing to do? But you're quite right that broadening of testing is also part of this. We talked about Saskatchewan doing that as of Monday. Vashi, before we went on air, you were talking about Alberta, because Calgary is now testing asymptomatic people, and it's showing some pretty dramatic things too.
Yeah, it's super interesting. So I think they've done, as of 2 days ago, 3,500 asymptomatic tests in Calgary. And the bulk of the cases, by far, in Alberta, 3/4 of them are in the Calgary and Brooks area. So that's why the AHS and Dr. Hinshaw, the chief medical officer, decided to target asymptomatic testing there. And what it showed is there are, I can't remember the exact number, unfortunately I don't have it on hand, but out of the 3,500, I think it was under 100 asymptomatic cases, but still a number of them presented positive. So that's fascinating, because we know about asymptomatic transmission, but we now have some data to back it up very specifically in a province in this country. And then they also found that the number of asymptomatic cases who had contact with a known positive case was greater. So I think it was something around 75
yes, you're right, exactly right.
There.
It was 123 tested. I only know this because Phil Ling has given me the numbers. 123 tested positive. 123 tested positive, and you're right, exactly right. 75 tested positive, and they had contact with someone with COVID-19.
Yeah. So it's super interesting because what it shows is if you have it shows the importance and significance of contact tracing. First of all, it shows second of all that asymptomatic transmission is a very real thing. And it's just fascinating to be able to say how much of a real thing, how pervasive is it in society? There aren't a lot of other provinces you can look at right now to be able to find some data to determine the answer to that question. And the answer to that question is so central when we talk about reopening the economy. We have to know to what degree this virus is invisible among us in order to be safe in emerging back into society.
Well, and let me bring in Catherine here. It also is so fundamental for the second wave, which Dr. Bonnie Henry was talking to our colleague Matt Galloway about this morning on The Current and said, listen, there are no pandemics where there's no second wave. And the fear, of course, would be that the second wave is worse than the first.
Yeah, and that moment where she says, you know, I try to be an optimist, but I've got to say that as you say, Rosemary, history shows us that's likely not to be the case. I would also flag, I was struck by the Prime Minister's sort of bubbling optimism there when he talked about being able to respond almost instantly when we do see a second wave hitting particular jurisdictions, that he wants this system to be up and moving so efficiently. He said that financial and logistical concerns really should not be an issue here. It should not hold us back. I mean, it sounds to me like it's a manner of saying really money should be no object when it comes to this. But I would contrast with that what we heard from the head of the Canadian Medical Association yesterday at a Senate committee saying we are not prepared for a second wave. Certainly, Dr. Sandy Buckman flagged testing as an issue. Also, the availability of personal protective equipment and just what he described as an ailing healthcare sector in general that has been overwhelmed by this, all the work that needs to be done. So we hear optimism from the Prime Minister, but I think broadly speaking, we know there is also a lot of concern. I think, Rosemary, it's quite a pivot, but we should really talk about airlines as well.
Yes, please do. Go ahead.
Just because there was, the Prime Minister faced quite a few questions about that, and because we know a lot of Canadians are interested in this issue. Many people, of course, had their trips canceled because of the COVID-19 outbreak that has affected international travel. And I just thought it was so fascinating to see the way the Prime Minister really set up a dichotomy there, right? Yes, we know people want their money back, but they also want a functioning airline sector when this is all over. And we heard him really being needled by some of our colleagues there to say, but surely people who have their money tied up, who have travel vouchers that they feel like they're never going to be able to use, this just is not fair to them. The Prime Minister would not put it in those words. He talks about these two competing concerns, that there are conversations going on right now to try to find a fair outcome for everybody. But the idea that folks are simply going to get their money back, as we have seen in some other jurisdictions around the world, I don't think that the Prime Minister offer people a lot of hope on that front. They're working towards some sort of a solution, but a full refund, he seemed to suggest something like that really could sink the airline industry in Canada.
Yeah, well, that's probably accurate. He called them careful discussions. Our colleague Ashley Burke has done a lot of work on this, obviously, but it's interesting because, if you look at the case of Air Canada, where they've now moved to lay off 20,000, half of their workforce, more than half of their workforce, and they obviously, can't keep going even with the wage subsidy, have not yet tapped into the large business emergency funding, and if they were then to be asked to repay to Canadians all the lost money in tickets, that I don't know what would happen to them. And I guess that's the Prime Minister and airlines' real concern. I'm not saying that the Canadians shouldn't get their money back. It's just you can see how the pressure of that would be enormous on an airline company right now. Maybe I don't know, would the government step in to fund that directly? That seems pretty like a pretty crazy idea too. I don't know.
Well, and when you put that on the table with some of the other concerns that the Prime Minister raised during the course of that press conference, this does lead right into that question about sick leave. BC Premier John Horgan saying that he wants a national program in order to fund sick leave. This is something that NDP leader Jagmeet Singh here in Ottawa has been talking about as well. And of course, that's so important when you stop and think about it in the context of all of this, because everybody does agree that we don't want people going into work because they don't feel that they can afford to take the time off of work, even if they feel that they are sick. But the question is, how do we fund that? We know that major business organizations in BC have said businesses should not have to shoulder this cost. But when the Prime Minister was asked about it today, he said, yes, it's a significant issue. So is making changes to long-term care facilities. He also talked about childcare. And so the list of things that need funding and attention in order to get society back up and moving just keeps growing, Rosemary.
Yeah, okay. All right, I will leave you both right there. Thank you both very much as the briefing gets underway. I should tell you there is also that's Vashi Capellas, the host of Power and Politics, and the CBC's Catherine Cullen. There is also a virtual COVID-19 committee that is happening today. The Prime Minister will not be in attendance, from what we understand. And so there's Michelle Rempel, Conservative MP there for Calgary. But if you want to continue watching that part of our coverage, you can do that still on CBC.ca/politics, but we will bring you today the briefing with cabinet ministers and public health officials here now. That is the president of the Treasury Board, Jean-Yves Duclos. Let's bring that to you live right now.
Good afternoon and bonjour à toutes et à tous. I will start with the latest numbers on COVID-19 in Canada. There are now 80,555 cases, including 6,062 deaths. And 41,108 cases, or 51%, have now recovered. Labs across Canada have tested over 1,377,000 people for COVID-19 to date, with about 5% of these testing positive. We're currently testing an average about 28,000 people daily, and the numbers change quickly and are updated regularly on canada.ca/coronavirus. So, it's time to have the talk. That is the talk about what some refer to as quarantine fatigue. As things are beginning to reopen, we want to get out, but at the same time, many of us are still feeling trepidation. Is the time right? How do I keep myself and my family safe? These are valid concerns. COVID-19 has not gone away, and the struggle is not over. So we need to talk about the practices that will allow us to go out smart and stay safe. There are still uncertainties and lots more to learn, but there are things that we know now that will keep us safe, including that we need to proceed with caution. Since we're going to be living with COVID-19 for the foreseeable future, we'll need to pace ourselves and go out smart by remaining vigilant with public health measures to prevent the spread of the virus. And this includes physical distancing, 2 meters from others, keeps us far enough away to prevent coming into contact with potentially infectious droplets produced when people cough, sneeze, laugh, sing, or speak, including those who do not appear to be ill. Avoiding touching common surfaces and objects reduces the likelihood of contaminating our hands with infectious droplets, so avoiding touching our mouth, eyes, and nose stops us from infecting ourselves. Cleaning our hands, often with soap and water for 20 seconds, or with hand sanitizer while you're out and after you get back, destroys the virus, and make sure you don't inadvertently infect yourself or contaminate things you touch. Extra layers, like wearing a non-medical mask or face covering, where COVID-19 may still be active and you can't keep a 2-meter physical distance, provides additional protection to prevent spread of infectious respiratory droplets, even if the wearer is not showing symptoms. By continuing with tried and true public health measures, we can all get out safely and keep COVID-19 down. Thank you. Merci.
Merci, Dr. Tam. Dr. Nu?
Merci. Thank you. Good afternoon. As usual, I will begin with the latest figures about COVID-19 in Canada. There are now 80,555 cases, including 6,062 deaths, and 41,108 have now recovered. This is equal to 51% of the cases. Labs across Canada have now tested over 1,377,000 people for COVID-19, with about 5% of these testing positive. We are currently testing an average of 28,000 people every day. These numbers change quickly and are updated regularly on canada.ca/coronavirus. So it's time to have the talk. That's the talk about what some refer to as quarantine fatigue. As things are beginning to reopen, we want to get out. But at the same time, many of us are feeling trepidation. Is it the right time? How do I keep myself and my family safe? These are valid concerns. COVID-19 has not gone away, and the struggle is not over, so we need to talk about the practices that will allow us to go out smart and stay safe. There are still uncertainties and lots more things to learn. However, there are things we know now that will keep us safe, including that we need to proceed with caution. Since we are going to be living with COVID-19 for the foreseeable future, we'll need to pace ourselves and go out smart by remaining vigilant with public health measures to prevent the spread of the virus, and this includes the following measures. Physical distancing, 2 meters from others. This keeps us far enough away to prevent coming into contact with potentially infectious droplets. These droplets are produced when people cough, sneeze, laugh, sing, or speak, and this includes people who do not appear to be ill. Avoid touching common surfaces and objects. This will reduce the likelihood of contaminating our hands with infectious droplets. By avoiding touching our mouth, nose, and eyes, we will not infect ourselves. Cleaning our hands, often with soap and water for 20 seconds or with hand sanitizer while you're out and after you get back. This will destroy the virus and ensure that you don't inadvertently infect yourself or contaminate the things that you touch. Wearing a non-medical mask or face covering where COVID-19 may still be active and when you cannot keep a 2-meter physical distance will provide additional protection. This will help to prevent the spread of infectious respiratory droplets, even if the wearer is not showing symptoms. By continuing with tried and true public health measures, we will all get out safely and ensure that we can keep COVID-19 down. Thank you very much.
Merci, Dr. New.
Thank you, Dr. New.
Good afternoon, bonjour. Earlier today, the Prime Minister responded to the calls from urban Indigenous organizations across the country for more support and announced an additional $75 million for organizations supporting First Nations living off reserve and Inuit and Métis living in urban areas. Over the past 8 weeks or so, we've seen leadership at all levels to protect the most vulnerable, our elders and youth, and to take collective action to support those who need it most. Women's groups, homeless shelters, mental health supports, assistance with food delivery has been organized by community-based organizations across Canada. In March, we provided $305 million in immediate support through the Distinctions-Based Community Support Fund. This enabled First Nations, Inuit, and Métis communities to address their specific needs as they prepared to react to the spread of COVID-19. To help respond to the pandemic, the fund included $15 million in support for Indigenous organizations that provide services to First Nations living off reserve or Inuit and Métis living in urban centres. Not only including major cities, but also smaller towns like Timmins, Ontario, or Prince George, BC. This funding helped 94 organizations supporting a variety of measures to help youth, homeless, and by providing food baskets, childcare, mental health supports, and sanitation and protective equipment. We've been able, for example, to support the important work of community-based groups like the Urban Native Youth Association, who is supporting Indigenous youth with self-isolation activity packages, technology, and education assistance, as well as financial support for frontline youth workers. We've also been able to support Iqaluit community Tukisiarkvik Society, who are providing Inuit elders with care packages of nutritious food and personal hygiene products, and the North Slave Métis Alliance, who is offering funding assistance to their members for essentials like groceries, prescription refills, and childcare expenses. Other funded initiatives are providing assistance in navigating and accessing the full range of government and community health, housing, and social supports, hiring emergency response coordinators, increased emotional support and wellness counseling, to name just a few examples. But this wasn't enough. We've also been able to fund organizations who are engaging Indigenous youth during this pandemic or providing technology support in the form of internet connects for family computers or prepaid phone cards for elders, just to name a few. Today's announcement marks a 5-fold increase in the amount of funding for urban Indigenous organizations. And I want to take a brief moment to acknowledge the members of Parliament from all parties who pushed very, very hard for this announcement to happen.
Since my last update last week, the number of cases on Indigenous reserves is stabilizing. We saw 201 confirmed cases of COVID-19 on reserves. 156 have recovered. We can also confirm that the 16 cases in Nunavut, northern Quebec, have also recovered. By looking at the number of cases that have recovered, we know that the curve is flattening. These are encouraging results, and it suggests that a number of communities have stopped the spread of the infection. However, we must remain vigilant. We must continue to follow the situation closely.
We've unfortunately seen a steady increase in the numbers of confirmed cases in the Blood Tribe Alberta over the past few weeks. As of May 20th, there are a total of 13 cases in the community, and we are in close contact with the Blood Tribe Department of Health to support the community's pandemic response plan, mitigating further spread of the virus by screening, testing, and ensuring individuals self-isolate as appropriate. Initial contact tracing has shown some evidence of household transmission and extensive social interactions among individuals who have tested positive for the virus. While these individuals did not present severe cases of the virus, there is, of course, the potential for wider community spread. And I want to reiterate the importance of physical distancing, limiting social gatherings, and when possible, staying at home. Together, by making this conscious effort, we can slow the spread of COVID-19.
As the flooding season is ending and the forest fire season is beginning, we understand the additional complexities that COVID-19 will present in the case of an emergency evacuation. Indigenous Services Canada is continuing to work with the provincial and territorial governments and First Nations partners to put in place plans and an emergency response plans that are efficient and that will guarantee the safety and security of all. To support these efforts, the 2019 budget that was announced of $48 million over 5 years, starting 2019-2020, and under the Fire Smart program, to support this capacity of First Nations to manage forest fires. This will continue and will help to ensure the resiliency of First Nations communities to deal with this growing threat.
Lastly, I would also like to add that the delivery of essential services and supplies in First Nation communities via charter flights continues, with the latest flight taking off yesterday, and to date 502 nurses and other healthcare providers have flown to or from 49 flying communities in Ontario, Manitoba, and Alberta. In addition to supporting the needs of the communities we serve, these flights also help keep communities, nurses, and our other healthcare professionals safe. Flights will continue every 4 weeks until it is safe to return to the previous process. In closing, I would like to once again thank all healthcare professionals working in Indigenous communities for their dedication and tireless efforts to ensure quality and culturally appropriate care, testing, and treatment during this pandemic. Miigwech, Nakumik, Marcy Cho. Thank you. Merci.
Merci, Marc. Merci tout le monde.
Thank you, Mark. Thank you, everyone. We are now very pleased to respond to your questions.
Thank you, Minister. So as usual, we're going to proceed with the phone first. 3 questions on the phone, then we'll turn to the room. 1 question, 1 follow-up each. Operator, over to you.
Thank you. Merci. Our first question, notre première question, nous vient de Micheline Laflamme avec Radio-Canada. Please go ahead. À vous la parole.
Question. Mr. Miller, the federal government gave additional funding to Kanastaki to deal with the crisis. Using this money, which was used to pay people who were managing the road controls, the mayor of Oka has criticized the fact that the federal government is funding blockades. What is your response? Will you intervene? What are you doing to deal with this crisis in the Oka Park? Mr. Miller's answer. First, I would say that it's difficult to judge people who are trying to protect their own community due to a spread of, or potential spread of COVID-19. I know that Indigenous communities have been exemplary in dealing with this very difficult situation. The money that was granted to Kanastaki as well as to other Indigenous communities across the country is being used to ensure the health and safety measures can be put in place to stop the spread, and to ensure that people can be safe and respect the guidelines set out, the health and medical advice that is being provided. Far be it from me to judge how these communities are exercising their right. In Kanastaki, there are people who still speak their language. There are some 60 people who speak their language. These are very vulnerable people. So we must respect that sensitivity. Anytime an elder dies, it is tragic. We must understand the situation in which they are living. We're talking about security checkpoints along the roads. These are not barricades. There is a difference in the way that these checkpoints are being operated. If you had followed the news in February, the federal government has indicated it could offer its services if requested. To date, the minister responsible has intervened and is in discussions with the Mayor of Oka and Grand Chief Simon. These discussions are bearing fruit. If they need assistance, I will say that I am in constant contact with the minister, and they need only call. The Government of Canada remains prepared to act if anything is needed, but they are managing the situation, and as you know, obviously, as I said earlier, if you had followed the situation in February, there is constant communication with these communities in order to resolve these different issues. Follow-up question. Thank you very much, Mr. Miller. My question goes perhaps to Dr. Tam or Dr. New. You will decide. President of the Canadian Medical Association, Dr. Sandy Buckman, said that the country is not prepared, for a second wave, and is concerned about the lifting of the current measures. There's a lack of medical staff. What do you think of this? What do we need to do? And do you agree? Thank you for the question. This is Dr. New. I cannot comment on the opinion of another individual, but I can tell you this. Dr. Tam and I continue to work closely with our counterparts in the provinces and territories, and with all levels of government. Everyone understands that there may be a second wave, perhaps in the fall. We are working very hard to ensure that we have the supplies of equipment required and the human resources to do the contract tracing, and enough vaccines for the seasonal flu. This is a current issue. We are continuing to work and prepare and plan. We want to be prepared for a second wave that perhaps might occur in a few months.
Thank you, Dr. Operator. Next question, please.
Thank you. Merci. Our next question, notre prochaine question nous vient de Jamie Pashagomskam with APTN. Please go ahead. À vous la parole.
Hi, thank you, Mr. Mill. Sorry. I'm wondering about the $75 million for urban Indigenous that you announced today. How will that money be divvied up? And specifically, will the CAP get its $16 million that it was asking for?
It's Jamie, right? Thanks for the question, Jamie. That 75 million will be divided up according to the submissions that we have received. As I had mentioned in a previous update, the $15 million that we had allocated was well oversubscribed, and so it is a question of allocating the remaining amounts, or even increasing current amounts that have been funded to organizations that are working on the front line to provide services to Indigenous peoples living in urban settings, increased amounts, and that's a decision that'll be taken within Indigenous Services Canada and rolled out in the most expedient fashion. I can't comment on the allocation as to any particular group that solicits funds. Obviously, we strive within the department to allocate these funds in an equitable fashion to serve those who need it most, in the most expedient fashion.
Jamie, follow up?
Yeah, thanks. You mentioned that you, obviously you've heard from CAP, but what assurances do you have that this is now going to be enough? Have you heard from other urban Indigenous organizations?
Well, it's hard really to comment on the sufficiency of funds that we allocate. We obviously looked at the profile of the amounts that were asked through a very open process that Indigenous Services Canada ran, and a very open submission process in a very short period of time, and noting that it was well oversubscribed. Obviously, it was an expression of need, but as I can't trace the outcome of the pandemic curve or as to whether second or third waves will hit and where and how, it is difficult to say that will be sufficient. Certainly, this funding is one of the largest envelopes for the urban Indigenous space, noting that they are service providers that haven't been particularly well funded in the past. So it is a very significant amount, and whether it is sufficient or not isn't for me to decide. We'll have to constantly, and as the Prime Minister says, constantly reevaluate as we trace the course of the pandemic.
Thank you, Minister. Opérateur, prochaine question, s'il vous plaît.
Thank you. Merci. Our next question, prochaine question, nous vient de Michel Lamarche avec TVA. Please go ahead, à vous la parole.
Bonjour, c'est une question pour le ministre Duclos.
This question is for Minister Duclos. With regard to airlines, why is it that we cannot say today to consumers that they will be refunded and that financial assistance requires refunds to consumers who purchase tickets? Thank you. There's three parts to the answer I will give. First, we fully understand the frustration of consumers in Quebec and across the country, people who bought tickets, made reservations, and paid, and now who are having trouble getting a refund. We also understand the very difficult situation in which airlines find themselves. We know that the short-term prospects for these airlines are quite modest and even of concern. Third, airlines should do everything they should and need to do to deal respectfully with their clients. If these companies want to reopen once the crisis has passed, they will need customers. And the way that they treat their customers now is essential. At the same time, to respond more directly to your question, I would say this. We are offering liquidity terms to companies, including airlines, in order to ensure they can keep their customers now, but also have some for later.
So we understand. I'll answer very briefly in English. So we understand fully the frustration that consumers in Canada have when it comes to getting their air tickets being reimbursed. This is a significant source of frustration for them, given that they have reserved and paid for their tickets. We also understand the difficult situation in which air companies everywhere on Earth, and in Canada in particular, are going through now and will be going through in the next while. So we know this is a crisis that is going to affect them for a little time. And third, we believe that they are they are best able and certainly expected to understand that if they want to have consumers in the future, they need to be treating them with respect. So given all of this, we also are offering these companies and many other companies ways to increase their liquidities and pay them emergency wages so that they can go through the crisis and work with their customers in the appropriate manner.
Michel, en suivi?
Supplementary question. Why, when we listen to the lack of an answer, that you're favoring the airlines rather than consumers? And I'd like to ask about seniors. Will they get the assistance you announced last week? Answer. We understand that it's a difficult situation for everybody. It's an emergency that has a negative impact on many, many people, but also on companies. And we expect these companies, as I said a few moments ago, to treat fairly and respectfully their customers. With regard to assistance for seniors, we are working quickly. The Minister said so last week, that we hope that the major investments that will be made as quickly as possible, as well as ensuring that they are made properly, so there is no errors made in the payment of these funding.
We'll now turn to the room, starting with Julie Van Dusen from CBC.
Julie Van Dusen, CBC. Dr. Tam, considering all the complaints about testing, that not enough testing is being done across the country, can one assume that Canadians aren't getting the full story then on how many people are infected? In other words, the numbers you reveal every day, can one assume they're much higher?
I think throughout this epidemic, we know that the numbers will be higher than the people who actually got tested. So during the height of this epidemic, there would have been people who stayed at home or had mild illness who would not have been tested. So at this phase, the strategy involves increasing testing in the community setting for people with even mild symptoms. Now, it's quite possible, and I know that I've heard from chief medical officers that, in fact, people are not necessarily showing up to get tested. Maybe they're not having symptoms, but there's also then needs to be more sort of systematic surveillance system set up to test different people in the community, particularly in high-risk settings. So I think that's part of the, obviously the strategy going forwards. All I can say is that, I think there is good collaboration with provinces and territories. Every level, as you've seen at the sort of very highest levels of government, people are seized with the need to increase laboratory capacity and testing. So I think as I think I mentioned yesterday, the key is to be able to jump on any increase in cases and do contact tracing really fast. So I think the other thing I would say is that that's why we have the immunity task force and the serologic testing, because we know that in this there is a sort of bit of the iceberg underneath that we don't know about in terms of the true prevalence of the infection and who had previously been infected. So the serologic surveys or studies will help us sort of further understand what is the sort of proportion or percentage of the population that may be affected. And that has to be done across different areas of the country, in different age groups and in different settings as well.
Thanks. Now, I'm just wondering when you think the second wave is coming, and are you concerned it's going to be helped along by the fact that we've got everything happening now, the nice weather, things opening up, and a lot of Canadians talking about getting in their cars this summer and driving around?
So we've been messaging the importance to adhere to the core public health measures, because I think obviously this is quite a difficult period. I think it's one of the most difficult periods of the time where people have been observing these public health advice, and now some things are easing up, and there's sort of exuberance of maybe getting out there means that people may forget to do all the core public health measures. So it is very important that we keep reiterate these messages. And as I said, I might sound like a broken record, but I will be doing this all the time, because right now is not the time to forget those core public health measures, like the physical distancing, washing your hands, covering your cough, etc., and wearing a non-medical mask if you can't keep the 2-meter distance in a community where the virus may still be circulating. I think what will happen is that if we don't essentially clamp down on any sparks, the immunity in the population, we don't know the true immunity yet, or the true sort of infection rate, if you like, but it's not going to be that high. So there'll still be susceptible people. And if they reignite another chain of transmission, we have to jump on it really fast. This virus can accelerate really quickly. And so we've seen it accelerating really fast in that first wave. So we have to be really cautious, because it might not take much for another chain of transmission and an escalation to occur. Be it small waves that we clamp down, we really need to suppress those so that, again, it doesn't overwhelm the health system. Dr. New talked about, planning ahead for different scenarios, and one of them is planning ahead for the next fall-winter season, because usually respiratory viruses, we don't know enough about this coronavirus, but many respiratory viruses increase in the fall-winter time, including influenza itself. So some of the planning does include making sure we have enough influenza vaccine, making sure that continuously we increase our capacity. We're still acquiring ventilators, still building up our PPE capacity, the testing capacity. All of those things has to continue to increase so that we will be prepared for different scenarios, including even a bigger second wave.
Thank you, Doctor. Mr. McGregor.
Glenn McGregor, CTV News. Question for Dr. Tam, just following up on Julie's question. Some Canadians are considering flying this summer as well. I don't know if you've seen some of the pictures from inside airplanes recently, but there is pretty much a breakdown of physical distancing, especially when people are getting off the plane. Passengers sit one row after each other, not anywhere close to being 2 meters apart. I'm just wondering, do you think, considering airlines are federally regulated, that there needs to be tougher and more enforcement of standards on travel, air travel right now?
So that's a really good question, because right now, what's in place, of course, is screening before someone gets on a plane to Canada. At the federal level, Transport Canada has instituted mandatory wearing of non-medical masks on planes and other federally regulated transportation. Because it is fundamentally almost impossible on a plane, and sort of the corridors, etc. There's more, I think, being done by the associations for the airlines, and also to look at, there's also other measures inside the plane that you might be able to do in terms of how do people get to the washroom? How do you, do proper environmental cleaning? How do you protect both the staff and the travelers and the environmental cleaning aspects? Also, of course, we will be continuing the border measures in terms of making sure people go then into mandatory quarantine. Other countries have lots of measures. So any traveler flying somewhere else need to be very cognizant of what those are. You might actually have to be isolated for 14 days somewhere else, so be prepared for all of those things. But I think that this is actually a very active piece of discussion in that sector. As in all businesses, Chief Medical is advising people to have a plan and let us see what that is. So I think that sector is trying to pull together all the different elements of the layers of protection that it needs to, in order for traveler confidence, I think, to be built up. But from a public health perspective, we are pretty extremely vigilant about this, because the virus has traveled to every country in the world. There's different activities still in different countries. We don't want that importation to occur. So it's both for traveler protection going out there and for people sort of coming back in, you would expect that level of vigilance and screening and isolation to continue. But of course, I will say that we'll have to keep evaluating these things on an ongoing basis. And I know that I'm not sure if Minister Duclos or others will talk about this, but obviously interdepartmentally, there's lots of conversations about how to safely look at air travel, or actually other forms of travel as well.
Thank you. Follow-up for Minister Duclos. You mentioned the difficulties the airlines are having. One of those challenges is that airlines are federally regulated under the Canada Labour Code, which can be more onerous in some cases, especially dealing with terminations of employees. Have you given any consideration, your government given any consideration to relaxing or waiving any of the provisions of the code so that airlines can respond more agilely to the crisis they're facing right now?
Well, that question is not only important, but of course would be best placed to my colleague, Minister Tassi. What I can say, however, is that our top priority is the health and safety of workers. We do feel and do understand that many companies, including air companies, go through difficult times. But protecting the health and safety of their workers is absolutely essential. So while we believe that there are extra costs to doing this, we also are offering all sorts of different support to make sure that not only is this the government's priority, but also the priority of businesses.
Thank you, Minister. Mike?
Hello, Mr. Duclos. So municipalities are talking about cuts from everything to arenas and pools to essential services like fire and police. Will the federal government, either on its own or in collaboration with the provinces, provide the $10 to $15 billion that is being requested by the FCN?
Very good. Well, Minister Freeland just yesterday and Prime Minister Trudeau a couple of times in the last few days as well have repeatedly said that we are fully mindful of the difficulties that cities and municipalities go through in Canada. And we are therefore hearing them. We are ready to help them. However, this has to be absolutely in collaboration and with the full support of provinces and territories. So this discussion is ongoing, and we look forward to continue it.
Thank you, Minister. We're now going to turn back to the phone. Operator.
Thank you. Merci. Our next question, notre prochaine question, nous vient de Hélène Bizetti avec Le Devoir. Please go ahead. À vous la parole.
Oui, bonjour. Ma question serait pour le ministre Miller. J'aimerais revenir à la question de ma collègue.
Minister Miller, I'd like to come back to the question asked by my colleague. Concerns the checkpoints, the road checkpoints near Oka. I understand what you said about security, but in your opinion, are these checkpoints legitimate? Answer. From the beginning, when it comes to Indigenous communities, it was important to ensure the relationship with the federal government to ensure that health and safety protocols were in place, with resources, funding resources to support this. Obviously, you know the relationship the federal government has with Indigenous communities. If we want self-government, we must respect the choices being made. I have said this to your colleague. Indigenous communities have been exemplary. We see the proof of this when it comes to the number of infections and the measures that have been taken in these communities to ensure that if there was an outbreak, it was stopped with the aggressive intervention and health measures put in place with, let's be frank, limited resources. They have rich histories and vulnerable individuals living in these communities. The chiefs, band councils is concerned in particular with these elders. When you talk about 60 people remaining who speak a language, you have to be careful. They have put in roadblocks, checkpoints at Oka and Ganastake. It's not a barricade. We're not talking about a crisis. We know what it is. And if you follow the news from February, you would see this kind of situation as the economy reopens will perhaps be repeated across the country. But we must remember that with our provincial partners and municipal partners, we're going to ensure there is a dialogue and the full respect for the health of individuals. I have been in contact with the chiefs, Minister D'Amour, and the latest news that I had was that things were being resolved, but we're not talking about a dispute when it comes to the health and well-being of individuals and a desire to protect those very vulnerable individuals. Far be it from me from judging the way in which these communities choose to implement the health protocols. We must continue the dialogue, of course. And the latest news that I had was that this was a situation that was being resolved.
Okay, we are going to pull away from this federal briefing. That's the Minister of Indigenous Services, Mark Miller, talking about a situation in a First Nations community where they are locking down some access to protect their community. But I'll bring in my colleague, Catherine Cullen, to talk more about some of the other things that came up during that press conference. Some really interesting comments from Teresa Tam around testing and contact tracing, I thought, there to help us sort of better understand what they are also trying to figure out right now in terms of the virus, Catherine.
Yeah, notably who it is that they're going to test, and this is something that we've heard her touching on lately. That it's not enough to just test the population generally. That you want to focus on particular areas where you know there is a lot of vulnerable population. She has talked in the past about correctional institutions, Indigenous communities, homeless communities as well. So trying to not just test broadly, because of course that's not really necessarily going to get meaningful results, although we did hear Vashi talking earlier about some interesting work going on in Alberta in terms of testing asymptomatic people, but trying to figure out precisely who needs to be tested and talking about how the key to making all of this work is to do it very, very quickly. I also thought, Rosemary, it was very interesting to hear her talk about the work that's going on behind the scenes when it comes to the prospect of a second wave, talking about the fact that she said they're still acquiring ventilators right now, which I think would probably come as a surprise to many Canadians. Perhaps not that they're still acquiring personal protective equipment, which she talked about, but there's still a lot of work going on behind the scenes to prepare to be able to scale up as we look at the future of this outbreak. So much talk today, particularly about the prospect of a second wave coming in the fall. Also, this conversation about what to do when that interacts with the prospect of flu season. Right? The need to give everybody seasonal flu vaccine. How do you even distinguish between the symptoms of the flu and of COVID-19? So preparing to have the vaccine, preparing to deal with that situation, all of that I thought quite interesting.
Yeah, I mean, she said something, the iceberg, we need to find the iceberg underneath, I think is what she said, meaning the people that have had the disease, or had the virus before, who maybe don't have it anymore, or who have antibodies against it. It was just, it's very interesting to talk about that, but also she was asked some questions about the future of travel, which I thought was particularly interesting too, because there are people who are thinking about in the summer, do I want to go see, my parents or my grandparents? And getting inside a plane, the prospect of that where 2 meters is virtually impossible, how would that work? And she says there are some conversations happening around that too.
Yeah, if I'm not mistaken, Air Canada in particular is the one that I'm aware of. They're offering options for international travel that really, let's not just talk about seeing family, but vacations as well. But is that something that people are prepared to do under the current circumstances? She certainly flagged some of the interesting issues, not only the spacing on the airplane in terms of getting into your seat, and perhaps a lot of people have seen, I know there was one article in particular, a journalist describing what it's like to get on an airplane right now and saying it is not a particularly, I believe this was an American journalist, but not a particularly pleasant experience, because you might expect that on all flights you're going to have that 2 meters of distancing, but in this journalist's experience that certainly wasn't the case. But she was saying even if you could space people out, what happens when you start moving around the airplane? What happens when you have to use the bathroom? It was interesting to hear her say that many departments are discussing travel, not just air travel, but all kinds of travel right now, and what does the future of that look like? Of course, that discussion intersects with the other one we were having about will we see a second wave? When does that that come? How long a time frame are we talking about? Just so many moving pieces to this discussion. And I'll just quickly mention, Rosemary, on the topic of air travel, it was also interesting to hear Minister Duclos say, vis-a-vis people getting their money back for tickets, if you want to have customers in the future, you need to be treating them with respect. So adding another dynamic to all of this. The airlines, cash-strapped, people want their money back. Another element to the future of air travel in all of this.
Okay, Catherine Cullen, my thanks for your help with all of our coverage today, and my thanks to Vashi Kapelas as well. You can see both of them later tonight. Vashi's show is, of course, at 5 Eastern. So as parts of the country begin to reopen, as we've been talking about, we do see businesses doing creative things to install new protective measures. That includes physical barriers. I'm sure you've seen it before. Adel Silavi is the co-owner of PlexiGuards in Vancouver, a very busy man. He's taken some time to join us. Good to see you, Adel.
Good to see you. Thank you so much.
So you were in the fabric business before, and now you've moved to plexiglass. How busy have you been?
Well, we were in the fabrication business, so we've been working with plexiglass and other materials like wood and other plastics. And we pivoted into creating these barriers mainly to help the community and stay in business as everything else slowed down. And it snowballed. We didn't expect it to snowball to this extent, and it's gotten to a point where we're extremely busy. And we're just trying to keep up with the demand and get everybody ready to open up for business.
Okay, so, I mean, when so many businesses are suffering or trying to get reopened, as you say, can you give me a sense of, percentage-wise or any kind of number about how big and how fast this business has grown?
Well, in the last 2 months, I would say when we started, it was a matter of getting 1 or 2 orders, maybe a day or every 2 days, and now everyone is scrambling to get open because now they've realized that you need these barriers to stay safe and keep your employees and customers safe. So it's gone up to maybe 30 to 40 orders a day, if not more, with the phone ringing literally every minute and emails going off the hook. So we're adapting. We brought a bigger team on so that we can create these barriers and get them out. And the customers themselves, the businesses that are trying to open, they are scrambling to get open, and I guess the news to them that they need these barriers has just hit. So everyone needs it in 3 days, or actually I need it yesterday.
Yeah, I only have about a minute, sadly. Obviously, it's great for you and for your business, but I wonder, do you feel sort of like a bigger sense of helping keep people safe and get businesses going? Have you had time to think about that part of it?
We do. Every time somebody comes and picks up the product, they are so grateful that they have it, and that makes us feel like we are actually helping because they say, thank you so much for getting it out to me, now I can get back to work. And that feels good.
Yeah, it should. I've been to lots of businesses with lots of plexiglass hanging from weird places, but doing a good job at protecting me and the businesses too. Adel Silavi, thank you so much, and good luck with the business. Keep up the good work. Appreciate it. Okay, that's Adel Silavi. He's the co-owner of PlexiGuards in Vancouver. Just one of the things that businesses are having to think about as they adapt and get ready for more of us to come to them. All right, that wraps up our coverage here on CBC News Network for today. I'm Rosemary Barton. I will see you back here tomorrow morning. Andrew Nichols picks up our coverage right here. You're watching CBC News Network. See you tomorrow.